First of all, thanks to Dr. Ashok sir for giving me chance to welcome Dr. स्मिता नायक मैम। माँ तुम्हें प्रणाम सीरीज में मैम का स्वागत है। मैम से मैंने बीपीसी में मीन्स बेसिक प्राइमरी कोर्स में बहुत कुछ सीखा है एंड अब भी बेसिक एडवांस कोर्स में भी सीख रही हूँ। पूरे टीम एचएसएच की तरफ से मैं मैम आपका वेलकम करती हूँ। प्लीज वेलकम एंड हैप्पी नवरात्रि।
Hello, Smita ma'am.
Yeah, Savita ma'am, bole.
Yeah, just I want to say something about you.
Yes, ma'am.
Yes, so happy Navratri, first of all
Happy
of you.
Navratri to you.
Yes, so I know Smita ma'am since we were together learning in BPC, right?
Yes,
So we are
BPC.
colleagues. Yes, so I know she's very much enthusiastic, active, I can say hyperactive, and a very good teacher also. Yes, yes. I'm very competitive also. You know, if you remember, once I present, then you said I also want to present in a better way that one. So it's very competitive. So I just so you are doing a classical homeopathic for 24 years, and after that you turn to mind method since and doing mind method practicing since 4 years.
Yes.
As teaching is your the passion since childhood. है ना? So that's the reason you are managing and teaching in BPC also, and now also you manage basic advanced course with other mentors also, right? So as a good she's a very good teacher, I would say, and very passionate and enthusiastic about the homeopathy. And Smita ma'am, I welcome you to Ma Tumhe Pranam series, and as I eagerly waiting to learn from you. Thank you, ma'am. Welcome.
Thank you, Savita ma'am. Thank you for your kind words. Yes. So today we start a very good case, but before that, I would really show my gratitude to my mother, who's no more with me, but she's the one who taught me everything that I know today. Not just being humble and being grateful, but to love everybody equally. So with her guidance, wherever she is, and pranam to Mata Saraswati, I begin my class today. I'm saying class because Ranjita ma'am had once told me that जब भी आप पढ़ाते हो ना तो ऐसे लगता है कि कोई सीनियर हिस्ट्री टीचर आके हमको अच्छे से पढ़ा रही है, समझा रही है. So let's see how this case is. I will just narrate the case once again with my understanding of this person. Okay. If there is any problem or if there is anything, just let me know in the middle. Okay. This is Mr. GM. He's a police inspector of 48 years old, staying with his wife and son. They stay at Pune, and since his sister stays near my house, they have been my patients. I have been treating his mother and his wife initially, and because it was successful, he also now started to come to me. So he came to me with this complaint of cracks on his feet, which was like very painful to him. Like, you know, those cracks, I've shared one picture also with you. Those were painful because he has to stand a long time for his physical training and all that. No? And sometimes it would bleed, sometimes it would pain, and a lot of discomfort. So he told me when he came to me that he has been taking treatment for it from a lot of places. He did Ayurvedic, he did allopathic, but it didn't help. His blood pressure is also raised occasionally, and he tries to, I mentioned this because he's so finicky about his lipids and triglycerides. Na? अभी LDL कम हो गया, अभी HDL बढ़ गया, अभी HDL कम हो गया, अभी मतलब he is very finicky. He will keep asking me how to reduce the cholesterol, how to maintain his triglyceride, little, you know, 2 or 3 numbers here and there, and he would keep asking me questions and how to maintain them ideally. And he will keep reporting like every 3 months religiously, vitamin B12, D3. Like sometimes we also feel, it is not so much necessary to be like, a healthy 48-year-old guy, but he is very, finicky about that. Even for his wife, son, or mother, like, mother is staying with him, he will get all the tests done as and when I ask them to, and everything will be uh, normal. He has to, how to make it normal, what to do, like that. He's very active, he's very fit. And then I asked him that why are you so, like, sensitive about slight changes in your cholesterol or triglyceride. He said, "Acha hai na, normally रहना चाहिए ना," like that. Then I jokingly asked him that, डर लगता है क्या heart ailment? I was thinking of calcarea cough. Somebody had pointed out, that calcarea cough हो सकता है. So I asked him कि डर लगता है क्या आपको किसी चीज का या हार्ट का प्रॉब्लम का. He said, नहीं नहीं, डरने का क्या है, God is there. मराठी में जैसे समर्थ कृपा आहे. That means Guru's Krupa is there, so why get afraid? But like, I can understand that whenever we got test and his vitamin B12 or D3 is less, he will take supplement immediately. He will make changes in his diet immediately. Sometimes he'll say, I will not have fish and non-veg because it will raise my cholesterol level. Then sometimes he'll say, B12 is low, so fir I will take it, like that, He's very religious. He attends satsang of Guruji. And inspector hai, we know I had few cases where, they would drink a lot, smoke a lot. Whereas this guy, he doesn't drink at all and he doesn't smoke also. Then I wanted to know what is the cause of all his, so much he's having this thing, the cracks. So I asked him that what happened before 2 years when you got it. When he got that heart scare ailment also, he was admitted for 2 days because his BP raised. Then he told me that one of his friends suggested him some scheme, there are some financial schemes wherein he has to pay 10 lakhs rupees and every month he gets around 15 to 20,000 rupees. So it's a big amount, like, and at the end of some 6 years or 10 years, they get their original money back. So he was like glued into it, and 2 months he got it, like, that money back. So he thought ki bichara, my sister, my brother, they are also like, all are hardworking. Let me ask them also to put, so instead of investing in bank and all that, they will get the money. So, 4 of his relatives, 3 sisters and 1 brother, they all paid 10 lakhs into the scheme. And what happened is 1 month, all of them got the interest, and then no interest, no original. That fellow said the business has gone bankrupt and he also ran away. So now this fellow, like, was really heartbroken. Being a police, he tried searching him, he found him also, he hit him, he did all this. He did whatever could be done, but somehow they didn't get the money back. So now he was worried. He said that हिंदी, like if I say, आज तक मैंने किसी का 1 रुपया उधार नहीं लिया, आज तक मैंने किसी को कुछ बोलने का मौका नहीं दिया, लेकिन I didn't want anybody, like, to think that I took their money or, anything of that sort. So what I did is I thought a lot, and then one flat he had, because he stays in a government quarters. So he said, one flat I have that I sold for some 42 lakhs and I gave all their money back, he said. And now I'm like, push, shant, he says that now I don't have to pay anybody, so I am not bothered. So, this, I asked him also that पैसा गया इसका दुख हुआ क्या. He said पैसा गया उसका नहीं लगा मुझे, लेकिन इनका सबका हार्ड अर्न मनी है और ये लोग क्या सोचेंगे मेरे बारे में, ये बहुत इम्पोर्टेंट था कि मेरी एक इज्जत है एक घर में, like everybody looks up to him because he's an inspector, he's been righteous always, मतलब he's been non-smoker, not drinker, तो सब लोग उसकी बात मानते हैं family में and all that. So he didn't want to spoil that particular image. And that is when he got this hypertension, chest pain, cracks on the heel and all that. So I, see, this gives us information that it is not the money loss or it is not the friendship deceived. It is his image which is there in the society, which he doesn't want to go. His family, his people who look up to him, and then he doesn't want that to go away. He wants it to be maintained like that only. Okay. Since I've treated his mother and his wife, I know a lot about his nature. he's very dominating at home, you know. Like wife says that बेटे को इवन छुट्टी के दिन संडे है या सैटरडे है तो सुबह 6:30 को उठना मतलब उठना है एंड एक्सरसाइजेस करना है टू रिमेन फिट. Like the son sometimes feel, you know, मेरे सारे दोस्त 8 बजे उठते हैं, let me sleep. No, he has to. Wife का भी वैसे ही है, wife has to behave in a certain way. He is very particular about that. Mother को भी, मतलब उनको हार्ट का प्रॉब्लम है तो वॉक करना है तो करना ही है आधा घंटा. He's like that with everybody at home, very you know, strict with everybody. With his diet, his reports, everything is very proper. So I just thought what to do and I took this. You can see the follow-up photos also there, huh? Initially the cracks were big and the skin was all hardened. Maybe because they have to wear the shoes for the whole time and all that. Then in the middle there was little progress and now it is completely cured. Even his heart problem is less and he is quite comfortable now compared to what he was. So let me share my analysis with you. I think most of you have given your analysis, so we don't have to discuss. Anybody wants to discuss? Anybody wants to give their analysis? सबने already दिया है analysis and very good analysis everybody has given. Most of you have come to the correct rubrics, like whatever rubrics I have taken was already given there. Only thing is some of you took some extra rubrics which make the remedy different. So see, he is a very straightforward inspector who's religious and he is a very caring person, family person, you know. He has created a name for him as a good person in the family. And when his friend suggested a scheme for him, he became very ambitious. कि चलो मतलब पैसे मिल रहे हैं तो invest करो और मेरे पास नहीं है तो मेरे family को भी invest करने दो, उनको भी, like, you know. So this looks like a caring person. But when all this money got devastated, his concern was about his image and social position, right? This all. So many of you took fear, social position about his. You know, his fear is there that his social position may go down. So that is a very apt rubric that we have over here. It is not fear nose getting cut. I don't know, like, you know, how to differentiate, but fear nose getting a cut of arsenic would be more of, you know, something like his name getting spoiled because of whatever other reasons. That this shows his social position. People are listening to him. He's a big brother kind of in the family, like that. You know, he's very dominating. So uska social position kam ho jayega. That was the main concern for him. Okay. Now he's very careful about his health. You are seeing, no, that सब कुछ एकदम बराबर होना चाहिए. बच्चे ने भी टाइम पे उठना चाहिए so that fit हो जाए. So carefulness is a very good rubric over here. Cautious and careful. Some in the basic primary we did the difference between cautious and careful. Cautious is something which we do before getting an illness, and careful is we are full of care when we get something. So he is careful about his health. He is careful about his family's health also. So I took carefulness here. He is very particular about his things, na. So fastidious आ सकता है ना. Fastidious is hard to please and very particular. रिपोर्ट्स हर 3 महीने में करना है. बराबर से थोड़ा इधर उधर कोलेस्ट्रॉल हो गया तो भी इज वेरी फिनिकी. वो कैसे बराबर लाना है. सो यू नो, फेस्टिडियस वाज वन मोर रूब्रिक आई टुक. I told you about when he was doing all this and I asked him, are you afraid of heart? Because it was very obvious that कोई भी जब ये LDL, HDL, कोलेस्ट्रॉल या ट्राइग्लिसराइड के बारे में बहुत फसी होता है तो दे हैव अ फियर दैट कहीं हार्ट अटैक न आ जाए. इट इज वेरी कॉमन एंड दैट इज व्हाई वी आर सो पर्टिकुलर. एंड व्हेन आई आस्क्ड हिम ही सेड नो गॉड इज देयर, व्हाई टू फियर. सो इट इज affectation. Some people have caught the affectation very nicely and that affectation rules out other remedies also. So he is pakka in affectation. What is affectation? Affectation is you are showing something else. It is you are displaying something else. Afraid है, डर लग रहा है, लेकिन बोलना नहीं है. Because कैसे बोलूं, मैं इतना बड़ा इंस्पेक्टर हूँ, या you know, even in front of the doctor, I don't want to show that I'm afraid because he will say God is there. God is there is an adaptation, na? Because he is very religious. He's very religious. He attends satsang. So God is his sahara for everything. Guru is his sahara. But he is showing affectation to me. That nahi, mujhe to koi dar nahi lag raha hai. So I took affectation. I took carefulness. I took dictatorial. See, dictatorial है ना वो अपने family के through that I knew this, you know, even if he didn't tell me, but wife has to behave in certain way, mother has to do these exercises, son has to get up. So with his family, he was. With me while talking, I never found him to dictate. But then being an inspector, sometimes the talks can be like that also, na, very, very like a dictatorial person. So that time I didn't take, but since I knew he was very dominating at home, I took that as dictatorial. Okay. Fastidious, fear, social position of, and religion, too occupied with religion. Sir, next slide, please. So I was surprised because I was thinking of Calcaria, but Aya Lyco. You know, because normally Lyco हम लोग boaster या फिर बहुत ambitious, ये सब देख के लाइको इमीडिएटली सोचते हैं. एंड ये केस में पढ़ने के बाद इमीडिएटली लाइको नहीं आएगा. बहुत लोगों ने जब केस वर्कआउट किया, दे गॉट लाइको. अदरवाइज वी वर गेटिंग अदर रेमेडीज, लाइक वी वर गेटिंग विराट्रम, वी वर गेटिंग ऑरम. So then I went one step ahead and I checked extremities, cracked skin on the feet. So you will be sometimes, you know, being a classical homeopath, that nature doesn't go, you know, to check whether this remedy covers it or no. So when you see cracked skin, sir, just slide change karo. You will see bleeding में Lyco is the only remedy. Cracked feet sole में तो है, लेकिन bleeding if you check, then you find Lyco is the only remedy. So again, that is also got confirmed. So then I gave him Lyco 200, 3 doses, as our mentors suggest to us. And the first 2 months, it was little less. Later on, I repeated it again. Same 200 ही repeat किया मैंने. And slowly he told me that the skin has become soft, the cracks have filled. And now you've seen the picture, it is completely better. His heart complaints are better, his BP is under control, and he's much relaxed. Now, you know, when I tell him that report karana hai, he says, ठीक है ना, wait करते हैं, देखते हैं. You know, so I'm finding that he's little relaxed compared to before. Okay. So Lyco is the remedy, and congratulations to so many of you who cracked it. Many of you cracked it. And more than that, I'm happy that everybody had these rubrics in their chart. Most of them, you know, everyone had rubrics, whatever I took, especially fear, social position of, fastidious, affectation. So many of you have got it in your chart. So this is lycopodium. Okay. So if you see some retro rubrics, like, you know, what are the rubrics which we can think of also. Ailments from cares and worries. Normally, हम लोग cares and worries में we don't consider Lyco so much, no? But it is a remedy for cares and worries also. Helplessness feeling. See, since we make a picture of lycopodium like a very, you know, hard on inferior, soft on superiors, we don't consider helplessness. But there is a shade of Lyco where there is helplessness, you know, especially in this case also. Retro, if you see that friend, वो आदमी भाग गया पैसा लेके और कुछ है नहीं है, तो how much helpless he was feeling. He said that मुझे समझाने में क्या करूं, उसको मार के भी मैं क्या करूं. That is why then later on he took this. So responsibility, taking responsibility too seriously. See, Lyco is both in responsibility aversion to take also, but it is in responsibility taking responsibility. Many of you took this rubric. Now he was so responsible. One is towards his mother. I have seen that he is very responsible. Secondly, अगर उसने बोल के पैसे दिए हैं सबने, तो it is his responsibility to give back the money. How many of them will actually think in that way? No, they will think that पैसा गया तो मेरा भी तो गया ना, आपका भी गया. So why should I give the money? But he said no. मेरे कहने पे उन्होंने पैसे दिए हैं, so I have to give it back to him. He still stays in a rental place, but he sold his house. So it shows his responsibility. Fear of breaking down under stress. This rubric ना like को single है लगता है. Fear of breaking down under stress. So कोई भी stress हो, you know, there is a fear. That is why maybe he is so particular about his reports. He's so particular about exercising. He's very particular. And impatient. One doctor also said, you know, carried desires to be carried fast. It is not carried desires to be carried fast, but it is impatient. Impatient. Abhi ka bhi hona chahiye. Abhi ka bhi report karna chahiye. Abhi ka bhi. So, you know, this is a impatience of lycopodium. These are few rubrics which normally we don't associate with lycopodium. But yes, you should think. So like Anu ma'am says, na, don't make a picture, take the rubrics of what the patient is saying or doing, and then later on when you get the remedy, check out whether this is there, whether the patient is in all these rubrics. Affectionate yet rough. It is his affection only, you know, for his mother or for his sisters which made him do that. But he is rough. He will be dominating. So it is affectionate yet rough. So I think all these rubrics are very good rubrics which we must take into consideration even when we think of lycopodium. Yes, is it clear? Because I want to teach you a very good rubric of lycopodium today, but let's see whether this much is clear to all. Yes, is it clear? Hello?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes. Am I going too fast?
No, ma'am.
No, ma'am.
So I hope everybody is like clear about this lycopodium for this police inspector. Yes. Hello.
Yes, ma'am.
Yes. See, in a subtle way, we saw the ambition. Na? Like not always will a lycopodium display his ambition. He's already a police inspector. We don't know how he is in his work, where he may be, you know, ambitious. But in this, we saw that, see, he already is doing some job. लेकिन उसने उसके फ्रेंड के कहने पे कोई स्कीम में इन्वेस्ट किया जहाँ पे पैसे मिलने वाले हैं. So it is a kind of, you know, ambition to earn more money also, no? Apart from like सिर्फ job में ही संतुष्ट नहीं है, but invest. We all do that, but investing money wherein we get interest and wherein we can earn more money. So in a subtle way, we can understand it is his ambition also, because we know it is lycopodium. It is a retro study, huh? And he wants his entire family to also earn money out of it. So in a subtle way we can, because lycopodium is a very ambitious remedy. And we know of that rubric, ambitious means employed every possible. Tell me how many remedies are there in this? Ambitious means employed every possible. How many remedies? Tell me. Who will tell me? Yes. See, where you have only 2, 3, 4 remedies, no, you should learn it by heart, huh? Because this will help you.
Yes, 3 remedies are there.
Yes.
Lycopodium and
Viratram. So see, only 3 remedies out of the entire materia medica, lyco, platina and viratram, are ambitious, means every possible they employ. What do you mean by that? What do you mean by this rubric? Means मतलब जिस तरह से we say ना, तो कोई भी तरह से वो ambition fulfill होना चाहिए. बोलते ना साम दाम दंड भेद. Anyway, I want this to happen. I was seeing Ramayana recently. So Ravan wanted Sita to be his wife. So first he tried with request, then he tried by showing her all the Vaibhav, then he started showing bad qualities of Ram, and then when she was not still convinced, he started dhamkofying her and telling her that I will kill you, I will do this to you. So you know, किसी भी तरह से मेरा उद्देश्य, ambition is your goal, your ambition is your उद्देश्य, किसी भी तरह से अपना goal fulfill करना is the meaning of this rubric. Ambitious मीन्स एम्प्लॉयड एवरी पॉसिबल। तो प्लैटिना, विराट्रम और लाइको ही है जिसमें हमको मालूम है ऑल थ्री आर डिक्टेटोरियल और ऑल थ्री आर हॉटी रेमेडीज। यू नो, किसी भी तरह से आई विल गेट माई गोल डन। Are you understanding? So you can understand which kind. So even in this, अगर लोगों को पैसे देने हैं, मुझे मेरा गोल फुलफिल करना है, तो मैं भले रेंटल में रहूं, मैं मेरा घर बेच दूंगा, बट आई विल फुलफिल दैट, यू नो। तो दे हैव द कैपेसिटी टू डू whatever they want. That is the strength of these three remedies, right? Mother rubric is ambitious, so they are ambitious. So Lyco is also ambitious. In this case, it is not obvious, but I am talking about Lycopodium in general. Is this rubric clear to all, everybody who's listening today? Anybody has any doubt, you clear it out today itself. Hello? Hello? Is it clear?
Yes, ma'am.
Yes, yes. I think most of you know it, but still, you know, we must remember this whenever we are seeing cases, you know, that agar 2-3 ही remedies है एक rubric में, then you should know it by heart, because that will come to your rescue when you're treating cases. Okay. Now, one more rubric, which is a very nice rubric about, this is not a prescribing rubric most of the time, but it is a rubric to understand the remedy. Some rubrics we take where we understand the remedy by this particular rubric. It is normally we don't take it to prescribe, because these are metaphors also. In homeopathy, in mind method, I learned about these metaphors from the mentors, which initially I would not understand, but sometimes it really comes to your rescue. Like we have Econite, anxiety better by cold drinks. You know, it was the first metaphor which I understood when I came into the mind method. I never knew this, and I was surprised to find when we are treating patients, and if our assurance acts like a cold drink, and that patient who is extremely frightened becomes calm and he says, "अभी मेरे को मतलब संतुष्टि है, अब मैं आराम से घर जा सकूंगा," then you take anxiety cold drinks ameliorate. So this is the metaphor. Similarly, we have one metaphoric rubric of Lyco, which I will just teach you today. Ailments from failure, literary and scientific failure. Have you gone through this rubric? Ailments from failure, literary and scientific failure. Yes? All of you have gone through this? Hello? Hello?
Ma'am.
Yes, have you gone through this rubric? Ailments
Yes,
from literary and scientific failure. And both, like, you know, very specific remedies like ignitia, lycopodium, you know, calcarea carb, that is there. So let me just see, you know, what does it mean? And ailments from whenever you take now, always remember, your chief complaint should start from that event. Then only you take ailments from. Suppose ailments from death of the loved one's hair. So they have to mention that after the loved ones died, my complaints start. Otherwise, like suppose the complaints start from 2 years and there is a death in the family 10 years back. So you can't take ailments from death of the loved ones. Are you understanding? कोई भी जब हम लोग PPP देखते हैं तो कोई भी रूब्रिक अगर हम एलिमेंट्स फ्रॉम से लेते हैं, देन द टाइमलाइन इज वेरी इंपॉर्टेंट. व्हाट डू यू मीन बाय टाइमलाइन? जब ये कंप्लेंट आया उसके इमीडिएटली बिफोर दैट इवेंट शुड हैव अकर्ड, ओनली देन यू कैन टेक एलिमेंट्स फ्रॉम. Are you understanding what I'm trying to say? Don't take ailments from just because you are getting cares and worries. That cares and worries should be the cause of this problem according to you, because you are talking to the patient, right? So now this ailments could be any disease, any complaints, any problem that he is. Literary and scientific failure का meaning क्या होता है? Now what is literary? Literary is related to literature. सो वी सी ना PhD में या कोई भी मतलब D.Lit है, M.Lit है, मतलब लिटरेचर इज व्हाट एक डीप स्टडी ऑफ दैट पर्टिकुलर सब्जेक्ट, वेरी डीप स्टडी पूरा अच्छे से, एंड द साइंटिफिक इज विथ साइंटिफिक प्रिंसिपल्स, इट इज नॉट सुपरस्टिशियस, इट इज नॉट मैंने सोचा और किया. Scientific is something which adheres to the science. Okay. Now failure, literary and scientific failure, मतलब क्या? Everything that is theory, literature, theory, and everything that is scientific has been done, and after that has failed, you get the ailments. Are you understanding? I'll give you versions and examples which will make it very clear. I had read this thing, Harun sir's message one place where he explained it very good. He has given very good versions for this, you know. I'll just read it out. Just go ahead, sir. Go ahead. In the clinic, how to catch this rubric. पेशेंट विल से ये पर्टिकुलर प्रॉब्लम के लिए मैंने सब कुछ कर लिया, यू नो, अच्छे अच्छे डॉक्टर्स को बताया, सारे इन्वेस्टिगेशंस किए, जो जो इसके लिए था. लाइक आई हैड अ पेशेंट हु हैड हाइटस हर्निया, सो एसिडिटी, चेस्ट पेन. सो ही सेड मैंने कितने तो डॉक्टर्स को बताया, सारे इन्वेस्टिगेशंस किए, एंडोस्कोपी किया, तो भी आई एम नॉट बेटर, यू नो, मतलब जो कुछ हो सकता है वो मैंने किया, लेकिन तो भी आई हैव लाइक डॉक्टर्स आर नॉट एबल टू कम टू एनी कंक्लूजन, एंड माय डिसीज इज नॉट बेटर. So there also we can use this rubric, ailments from failure, literary and scientific. Then you can see some mothers, they have given the best sanskars to the child, you know, and maybe today that child has become an alcoholic, or the child is not earning well, or the child is gone into some bad habits. So she will say कि मैंने बचपन से उसको सारे अच्छे संस्कार दिए, मैंने अच्छे से उसकी परवरिश की, उसको किसी चीज की कमी नहीं थी, सब कुछ दिया, तो भी पता नहीं ये कैसे ऐसे निकला. You know, that is her worry, and after that she gets this ailment. So, you know, मैं fail हो गई. Somewhere they may not say this, but somewhere they feel that I have failed in my upbringing. This also सर ने दिया था वर्जन में, डॉक्टर साहब मेरे सन की वजह से मैं बहुत दुखी रहती हूँ, वो बिगड़ गया है, उसको सही राह लाने के लिए मैंने बहुत ट्राई किया, बहुत से बड़े लोगों के जरिए समझाने की कोशिश भी की, बड़े बड़े संतों के पास ले गया, लेकिन सब नाकाम हो गया, इसलिए मैं बहुत डिप्रेस्ड हो गया हूँ. नो, अनदर वर्जन सर गेव इज, मैंने अपने बिजनेस में ग्रो करने के लिए बहुत मेहनत की, कस्टमर रिलेशंस भी बनाए, प्रोडक्ट भी अच्छी क्वालिटी की रखता हूँ, मार्केटिंग में भी कोई कमी नहीं रही, सब कुछ करके देख लिया, लेकिन बिजनेस नहीं चला, इसीलिए मेरी हिम्मत आज टूट गई हूँ, बहुत परेशान हो गया हूँ. नो, सी दिस इज वन मोर वर्जन. देन ही सेड, डॉक्टर साहब मुझे एक लड़की पसंद थी, मैंने उसके सामने अपनी इम्प्रेशन भी अच्छी बनाई, उसको खुश करने के लिए बहुत सारी कोशिश की, उसको जैसा एटीट्यूड पसंद था वैसे बनाया, लेकिन जब प्रपोज किया तो उसने मना कर दिया, तब से मुझे डिप्रेशन आ गया है. सो दीज आर डे टू डे एग्जाम्पल्स. एंड आफ्टर दिस काइंड ऑफ फेलियर, इफ द पेशेंट tells you, then you use this rubric, ailments from failure, literary and scientific failure. इसमें lycopodium is also very important rubric. rubric समझ में आया सबको? हेलो हेलो.
Yes, madam.
Yes. So a few things about lycopodium in general. Anybody wants to say, or anybody wants to give their clinical experience? Anybody? Hello.
हेलो.
किसी को बोलना है अपने लाइकोपोडियम के कोई केस, छोटे में, स्मॉल में?
हेलो, मेरी आवाज सुनाई दे रही है?
हाँ सुवर्णा मैम बोलिए.
जी मैम, आपने एक केस शेयर किया है ना, तो उसमें है वो पुलिस एक्सरसाइज करता है, वो कंप्लीट रेपर्टरी में एक सिंगल रूब्रिक है उसका कि वो फिट रहना चाहता है, इसलिए एक्सरसाइज जॉगिंग करता है। तो वहां
अच्छा
पे लाइको और एक अनकॉमन रेमेडी है, तो वहां पे ही मुझे पढ़ने के बाद लगा कि ये लाइको है, लेकिन फिर किसी ने
व्हाट इज
कहा
द
कि
रूब्रिक?
कल्केरिया का
व्हाट इज द रूब्रिक?
फिट डिजायर, इसके लिए वो रन
अच्छा,
जॉग एक्सरसाइज करता है।
ओह अच्छा, वेरी गुड।
हाँ, हाँ, ये पेशेंट भी है ना, वो फिट है, बच्चे को भी
यस
सुबह जल्दी उठाता है
यस
एक्सरसाइज के लिए।
यस
और
यस।
सिंगल रेमेडी है यहाँ पे लाइको।
अच्छा, very good. See, we don't know sometimes, we get to learn newer aspects of the remedy. Very good. Yes. Anybody wants to share something else which you got during this study, today's study of lycopodium? See, lycopodium is in that cycle of calcarea, lyco, sulfur, because antisoric remedies है, इसीलिए बहुत बार क्या होता है ना, अगर lycopodium remedy है, then it will have shades of calcarea and sulfur also. Or if calcarea or sulfur are the remedies, then you will get these shades also. So ये cyclical remedies भी हमेशा याद रखो, because sometimes if you don't get results with one remedy, you can always try another remedy. So calcarea, lyco and sulfur are one such cycle. Calcarea, they say, gives you stability and security. Lyco helps you grow. And after you have grown and got this ego, then sulfur will maintain that name, ego, image. So it is that way. It's a cycle. Yes? Hello?
आर्सेनिक भी आ रही थी मैडम, लेकिन आर्सेनिक में इतना वो फैमिली की केयर नहीं करता ना।
हाँ.
आर्सेनिक बाइटिंग कम लगती थी ना।
Yes, yes. And arsenic है fastidious वगैरह, but I was not getting that arsenic का जो भी वो था ना, that feel of arsenic we say was not in this particular patient. He was more that anxiety of arsenic is very obvious, na? It is very irritating to you. Here he was more cautious, he was more careful. So let me just give a few more rubrics of lycopodium for our study, just for 5 minutes, and then we will end it. So normally lycopodium patients are very intelligent. You always remember, they are intelligent patients. We have rubric also. Emotions predominated by intellect. And physically they may look thin, or they may not be very well built, but mentally or intellectually they are very strong, and they are very good, in their mind. So they are intelligent. Egotism hai, dictatorial hai, haughty, stiff and pretentious is one rubric. Haughty we know, that's why we saw Platina and Virat also. Stiff and pretentious. So maybe because this guy was an inspector, he was always stiff and pretentious. But otherwise also lycopodium will pretend that he is very strong, he is very big, he is very... That's why we consider boasting in him, no? Hard for inferiors, kind for superiors is what initially when we study first year only we are taught this rubric in BHMS, that they especially children, अगर मम्मी और डैडी है, डैडी बहुत स्ट्रिक्ट है, तो डैडी के सामने वो हाजी हाजी करेगा, और मम्मी के सामने वो he will try to insult her or to do dadagiri in front of her. Same like school में he will be very obedient, very good boy, but at home he will be डॉक्टर के क्लिनिक में भी दे विल से यहाँ तो बहुत अच्छा बन रहा है, लेकिन घर में तो ये हमारे नाक में दम कर देता है. सो दैट इज व्हेन वी यूज हार्ड फॉर इंफीरियर्स, काइंड फॉर सुपीरियर्स. Then we have few sadness rubrics also, few weeping, resignation. Resignation is one rubric which lycopodium is in. What is resignation? When do you resign? Normally we resign when our duty age is over, 58, 60 is the time. Or you resign before, give up. give up we say na. So resignation is lycopodium gives up also very easily. So resignation में है weary of life waking on, sadness waking on. Waking on के भी बहुत सारे rubrics है lycopodium में. Please go through all those rubrics also. Okay. Normally they are very ambition increased, power love off and all that. But when things don't go their way, they become discouraged and helpless and they go into despair, resignation and sadness. And they feel that now they cannot recover from this particular slide downfall. Yes. Should I give you a few more rubrics of lycopodium or we call it a day? Hello. Few children rubrics we will discuss. Anybody wants to give few rubrics of the child? We have flattering, seducing behavior in children. So children also, once we said na साम दाम दंड भेद, they want किसी भी तरह से उनका काम हो जाना चाहिए. So seducing, flattering the mother or flattering the teacher or flattering the grandparents can be done by the children. So flattering, seducing behavior in children. Irritability in children. Impolite children. We also have that. Awkwardness children in. Kicking children in. Cross, kicks and scolds on waking. During our college days, our professor had taught us this, that as soon as he gets up in the morning, he's very chilchida and irritable. That's where this rubric is there, Kicking children in, cross, kicks and scolds. Sulfur is one remedy which will laugh and get up, smile and get up, be happy and get up. Whereas Lyco is one remedy who will always be, grumpy and kirkiri, we say, kirkira when he gets up. We know that lycopodium is very much afraid of new things, very much afraid of going on the stage, though he is capable of, but extremely nervous before doing something new. Timidity public about appearing in, talk in public, capable but he has capacity, but he is afraid. Okay. It is a very good remedy for hypocrisy. Hypocrisy we know na, ek bolega ek karega. Ailments from anticipation. Weeping thanked when. Last week only I saw two people, with this rubric. I don't know, I want to prescribe to them, but they were not my patients. One uncle of mine, when मतलब हम पैर छूने गए या हम just love show करने गए, so they were weeping. Maybe this could be a sign of old age also. I don't know. But when I look back in this rubric, weeping thanked when. So they get so emotional. They are so emotional that even when somebody thanks them, they will weep. That is also one rubric in lycopodium. Weeping future about the. So sometimes we can also think of this remedy in two extremes, the childhood and the old age also. Fishing aptitude for. What is fishing aptitude? Now I'm only talking about few rubrics which are little different, not the regular rubrics. What is fishing? Fishing is जाल डाल के fish को पकड़ना. If you have seen, when we fish or when, I don't know, I had seen as a child, they will put earthworm to the hook and they will put it in the water. So the fish is lured that food aaya hai, and when he goes to eat, you pull that rod up. That is fishing. Or the fishermen, they throw the net in which all the fishes are caught. So that is fishing. So lycopodium has got fishing aptitude. What do you mean by that? Who can say what is the meaning of this particular fishing aptitude? We know artistic aptitude, no? We know mathematical aptitude. What is fishing aptitude? Yes, anybody wants to try?
मैम उसका मतलब होता है कि किसी को फंसाना.
ये जाल में फंसाना ना, तो मीठे मीठे बातों में फंसाना या कैसे भी करके, you see salesmen ना, sometimes हम साड़ी या ड्रेस लेने जाते हैं Sometimes we don't even want to buy that particular thing, लेकिन the way he says, वाओ कितना अच्छा लग रहा है आप पे मैडम, आपका तो चॉइस ही बहुत अच्छा है, आप तो इतने मतलब लगता ही है आपका चॉइस एकदम एक्सक्लूसिव है. So even if we don't like that thing, you know, sometimes we are tempted to buy it and we buy it also, and after coming home we think अरे इसने तो मेरे को you know फंसा दिया है ना. So fishing aptitude is anybody who has that quality. गंजे को भी कंगवा बेच आता है, we say ना बहुत बार. So they can do that, you know, some marketing people and all, they have fishing aptitude. So how many remedies in that rubric? Check how many remedies. Fishing aptitude for
remedies are there.
yes, but main ones are Lyco, Cilicia, na? Yes. You will see frowning, लाइको के फेस में ना बहुत बार जो सीरियस लाइकोज होते हैं ना, they will frown, frowning रहेगा उनके चेहरे पे. They will look like, you know, older than their age maybe, or they look very thin. Gas, yeah, when I would do my classical practice, gas, full of gas, whatever they eat, थोड़ा भी खाया तो पेट भर जाता है. You knew this, na? Lycopodium is a very good remedy for gastrointestinal tract, the chief sphere of action on the liver and the GI tract. Yes, and it is a multi-miasmatic drug, so it is capable of curing even severe pathologies. So when you know of multi-miasmatic drugs, you should know that it is capable of curing acute as well as chronic pathological cases also. It is a very good remedy for lung and liver problems also. Liver is also a very important sphere of action in lycopodium. I think बहुत कर लिया, बहुत अच्छे से rubrics कर लिए and case भी कर लिया. Yes, anybody wants to add any good rubric which they know of lyco? Hello? सब सो गए क्या, कि थक गए? हेलो.
नहीं मैम, सुन रहे हैं.
Okay, so I hope that all of you use these rubrics in lyco and go through today in the evening when you're a little free from your practice. Just read all the rubrics of lyco and try to correlate it. You will see so many common rubrics of lyco with silica also. So there can be a confusion between silica and lyco also. Try to find out how you will differentiate between it. And you will also see lycopodium coming similar to virat also. Virat is but obviously very, very ganda admi. But then still you can find a lot of rubrics common between virat and lyco also. So go through it, find out how you will differentiate. I had very good results of lyco in a case of infertility, where that man was suffering from impotency and he didn't want to admit it. He didn't want to, make it obvious to me when we were taking the case, and he would always say that his wife needs treatment, But in infertility cases, always see to it that you treat both the patients. At least nahi treat bhi kiya na, so when you are doing the case taking, call both of them, and once at least talk to the husband, at least to know when you're taking the wife's case that what kind of behavior the husband has towards her. So in that I found out that he was a lycopodium guy with impotency issues. So I said, I will treat your wife, but you also take one remedy because infertility ke liye help hota hai. And I had given lycopodium to this guy and I had got good results. That wife, I don't remember what remedy, this was long back, but then I had given lycopodium. Yes. And that case got cured. So lycopodium is also a very good remedy for impotency. Okay, shall we end our day today, the session today? I hope this case helped you differentiate between viratram, differentiate between calcarea, जो हमने starting में सोचा calcarea है करके, लेकिन it turned out to be lyco. Thank you so much.
Thank you ma'am.
Thank you.
so much, ma'am.
Yeah.
थैंक यू सर, थैंक यू.
Good day.
लाइकोपोडियम को 2 लाइन में बोलूंगा शॉर्ट में कि लाइकोपोडियम का एक की नोट जो रूब्रिक है जो मैक्सिमम केसेस में आपको आ जाके डायरेक्ट में नहीं आएगा तो विधि में आएगा, हार्ड फॉर सुपीरियर और सॉफ्ट फॉर इंफीरियर।
हार्ड फॉर इंफीरियर, सॉफ्ट फॉर सुपीरियर सर।
लाइकोपोडियम जो आपने बताया कि एनी हाउ अपने एम्बिशन को पूरा करके रहता है, साम दाम दंड भेद जैसे भी हो, अपने बॉस के सामने जाएगा, उससे काम निकालना रहेगा तो पोलाइट होके उसके पैर पड़ के भी अपना काम निकाल लेगा, और अपने जूनियर्स के पास जाएगा, अपने सिबिलों के पास जाएगा तो पावर दिखा के, डर दिखा के, मैनिपुलेट करके उनसे अपना काम नहीं, पर दोनों जगह उसका अपना काम होता ही रहता है, कहीं उसका काम रुकेगा नहीं। फास्फोरस का काम नहीं रुकेगा क्योंकि उसके फ्रेंड्स बहुत हैं, उसके सपोर्टर बहुत हैं, वो अपनी दोस्ती से अपने सारे काम करा लेगा। लेकिन लाइकोपोडियम कैसा करेगा, जहां जैसी जरूरत है वैसे अपने नेचर में वो करके चेंज करके और अपनी वो ले लेगा, अपना काम सॉल्व कर लेगा, अपनी जो भी उसको करना है वो करके ही रहेगा। जहां नहीं होगा, जहां वो फेल होगा, वो वीप करेगा, एंजाइटी वीपिंग जो रूब्रिक है लाइकोपोडियम के, आप देखिएगा वीपिंग भी वो करेगा तो सामने वाले को से अपना काम करवाने के लिए करेगा, गुस्सा भी करेगा तो सामने वाले से काम कराने के लिए करेगा, कहीं झुकेगा भी तो अपना काम कराने के लिए झुकेगा। तो लाइकोपोडियम बहुत बड़ा सर्वाइवल है। ये जो पेड़ है वो सबसे पुराने पेड़ों में से एक है, सारी आंधी तूफान भूकंप ज्वालामुखी सबको झेल के आज भी जिंदा है। तो दिस इज लाइकोपोडियम कि हर कंडीशन, हर अपोजिट कंडीशन को में रह के और अपने फेवर में अपनी कंडीशन करके अपना काम करा के सरवाइव करता रहता है और जीता रहता है। पर एट लास्ट एंडिंग ये होती है कि ये अकेला पड़ जाता है जब इसके बारे में इसका आईपीआर जान जाता है कि यार मेरे इससे इसके सुपीरियर जान जाएंगे कि ये तो मीठा मीठा बोल के अपना काम निकाल लेता है, ये है इतना नहीं, ये तो उतना ही कनिंग है। और इससे जो इंफीरियर वाले हैं उनको तो मालूम है कि हमेशा से डोमिनेट करके अपना काम करता आया है, तो धीरे 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 इसका आईपीआर इससे दूर होता जाता है। और लाइकोपोडियम वो पर्सनालिटी है जो ओल्ड एज में अकेला पड़ जाता है, इसके आसपास इसका कोई हेल्पिंग हैंड नहीं रहता। ये लाइकोपोडियम की एंडिंग होती है। तो ये थोड़ा सा लाइकोपोडियम का था जो मेरी तरफ से था। थैंक यू स्मिता मैडम, बहुत बढ़िया आपने पढ़ाया। और
थैंक यू सर।
Thank you, sir. Thank you so much.
Thank you again, gratitude to all of you.
Hello, doctors. For those who are new to the mind method or are into GP practice but want to start homeopathic practice, HSH is bringing you a basic course of applied mind method. The basic course starts in January, where we will teach you rubric selection, common version of patients, daily used rubrics and remedies, entry point of those remedies, confirmatory questions of remedies. You will get recording of these sessions for 3 months. This course will enable you to start your practice independently. You can enroll for our program. This course will connect you to a group of mentors who are always ready to help you anytime you are stuck in your case. For more details, contact Dr. Ashok Avadia. Phone number 9893805528. Thank you.